Ever wondered what happens to your body when you sip on that morning cup of joe? Well, buckle up because we're about to embark on a fascinating journey, exploring the effects of coffee and its primary active ingredient, caffeine. Imagine that first sip of coffee. The aroma, taste, and warmth begin their work even before the caffeine hits your bloodstream. Coffee, for many, is a significant source of antioxidants in the Western diet, even surpassing fruits and vegetables. These antioxidants, including a potent one called chlorogenic acid, swing into action, neutralizing harmful free radicals and potentially reducing the risk of chronic diseases like cancer. As the caffeine enters the nervous system, it plays a protective role against neurodegenerative diseases. It blocks adenosine receptors, potentially preventing the buildup of amyloid beta plaques, a significant marker of Alzheimer's disease. Simultaneously, other coffee components safeguard neural circuits, reducing the risk of diseases such as Parkinson's. Moving on to metabolism, coffee consumption has links to a lower incidence of type 2 diabetes, thanks to its ability to enhance insulin sensitivity and glucose metabolism. It's notable that with every additional cup of coffee per day, the risk of developing diabetes drops by 7%. However, when it comes to cardiovascular health, coffee and caffeine have a somewhat complex relationship. While a sudden intake of caffeine can increase blood pressure, habitual consumption has several positive effects, including improved endothelial function and an anti-inflammatory state in the cardiovascular system. Consuming 3 to 4 cups per day is associated with the lowest risk of coronary heart disease. Caffeine also significantly enhances physical performance. It increases adrenaline release, which boosts the mobilization of free fatty acids from fat tissue and muscle glycogen stores. This process delays fatigue and reduces the perception of effort during physical activities, improving endurance and strength. The mental health benefits of caffeine are also worth noting. Caffeine improves mood and cognitive function by increasing the release of dopamine and norepinephrine, neurotransmitters that enhance attention and overall mental well-being. Regular coffee drinkers might be pleased to know that their habit is linked to a reduced risk of depression and suicide. Yet, like all things, caffeine has its drawbacks. It can disrupt sleep patterns, impair calcium absorption, and during pregnancy, it can be associated with higher risks of miscarriage and low birth weight. So, to brew or not to brew? The answer isn't so straightforward. While coffee and caffeine offer significant health benefits, they also present risks. The balance of these effects largely depends on individual factors and consumption patterns. Moderation and personal tolerance are key to reaping the benefits of coffee while minimizing its drawbacks. So next time you sip that cup of joe, remember the complex yet significant role of coffee and caffeine in health management. Enjoy every sip, for it is a journey through your body.